Hi, I'm Kenny, J. Kenny. This is my house. It's big. These are my friends and my family. I live with them also. It's a bit crowded sometimes. Whew, I finally escaped. Today, I'm visiting a friend. This is Kentucky. She's my friend. Hi Kentucky, how are you doing?
I'm having a little problem now. I'm not feeling well, but I don't know what's happening to me. My friends and family are having the same problem, and my auntie said that I may be suffering from coccidiosis.
I think we should consult the vet nearby our neighborhood.
That's a great idea. Let's go. Doctor, I'm not feeling well.
I see. Can you explain the abnormalities you observe in you and your friends?
Oh, doctor, I observed that there are bloody droppings in the house and blood stain at area around the vents of my friends. And I don't feel like eating recently and I lose my weight. My friend also told me that she doesn't look pretty anymore because she has ruffled feather.
The clinical signs you and your friends have seems like coccidiosis. In severe case, death might occur.
Oh my god. Doctor, are there any other possibilities other than coccidiosis?
Yes, they are. Your friend may be suffering from salmonellosis, colibacillosis, ascariasis, and leukosis. To further confirm what is it actually, I'll need to proceed with some diagnostic workup. I had done postmortem on a friend of yours, and these are the lesions I have found.
Viewers' discretion is advised. There are petrification and thickening of the distal third or more of intestine, extending into the cecal tonsil. There are black discoloration can be seen with corrugation of the intestine indicating edema. The morphological diagnosis is severe necrotizing enteritis. Dr. Cluck also took an intestinal scraping for the detection of oocysts. And yes, she is right. She found the oocyst egg.
I have done all the diagnostic workup, and I can confirm that it is coccidiosis, specifically Eimeria bruneti.
I'm so sorry for you, Kentucky. But doctor, what is coccidiosis?
Coccidiosis is caused by protozoan, which are host-specific and site-specific. And usually, the protozoan are Eimeria species. Eimeria will usually attack the intestinal mucosa and proliferate within the intestinal mucosa. Hence, it destroys the intestinal villi. There are 9 species of Eimeria in poultry, namely Eimeria tenella, Necatrix, Acervulina, bruneti, Maxima, Metis, Precox, Hegani, and Mivati. So, I'll explain the life cycle of Eimeria to make you more understand about coccidiosis. Sporulated oocysts that persist in the environment are ingested. Each oocyst contains 4 sporocysts with 2 sporozoites each. In the stomach, the acidic environment favors release of sporocysts. The sporocyst then travels to intestine and liberate sporozoite. Sporozoites invade enterocytes and undergo few phases of asexual reproduction, including schizogony. Merogony occurs and merozoites are released to invade other intestinal cells and multiply again. Sexual reproduction occurs, which gametes are formed. Microgamete fertilize macrogametes and zygote is formed. The immature oocyst is shed in the feces. Under favorable and correct climatic conditions, sporulation of the oocyst occurs and sporulated oocysts become infective.
I see. How does the protozoa cause damage?
It's because of the pathogenicity of Eimeria. Cell evasion occurs at first. This occurs first with target cell recognition between cell surface and anterior end of the sporozoid. The macroneme secrete antigen that coat the parasite and form link between parasite actinomycin, cytoskeleton and host cell surface. The parasite is then taken up by the target cell. It is enclosed by parasitophorous vacuolar membrane to protect it from phagolysosome of host cell. The sporozoites and merozoites undergo multiplication in host cell. The uncontrolled cycle of host invasion and parasite proliferation increase the parasite burden in a cell, resulting in cell lysis. The parasite also has cytotoxic effect to the host cell. This causes ultrastructural damage of enterocyte, which there are detachment of the microvilli. As the consequences of structural damage of enterocyte, malabsorption and maldigestion decrease nutrient uptake, leading to weight loss, emaciation, and also poor growth rate and decreased egg production. Loss of nutrients also contribute to ruffled feathers. Maldigestion also cause accumulation of unabsorbed ingesta. The unabsorbed ingesta is degraded and fermented, leading to the increase of the osmolarity in the intestinal lumen. Thus, excessive water is secreted, causing diarrhea. Diarrhea can be worsened as there is a failure of resorption of water in the intestine. Bloody diarrhea occurs when there is a rupture of blood vessel, causing hemorrhage. In severe case, death can be due to hypovolemic shock, which is caused by diarrhea.
Oh, such a clear explanation. How about the treatment? Can Kentucky and his friend be treated?
Don't worry, this disease is treatable. There are several drugs can be used to treat this disease. One of the drugs is amprolium. You'll need to mix this drug into your drinking water and take it for 3 to 5 days. This is antibiotic. You should take this drug with food. Eat this daily for maximum for 5 days. You can also use Baycox too. Here, Kentucky, take amprolium with you.
Thank you so much, doctor.
You will get better, Kentucky.
You'll have to give this medication to your family too. Everyone that has contact with you need to take the medication. Even you, Kenny.
Eh? But I don't have any signs of sickness.
Yes, but you might get it. So this is for preventing you getting it from Kentucky. Calm down. Everyone that have contact with Kentucky, with signs or not, have to take the medication. It is to prevent the silent spread of the disease. There are several ways to prevent coccidiosis outbreak in a farm. First, add coccidiosis drug into the feed. Second, add feed additive and supplement into the feed. For example, betaine. Betaine promotes healthy intestine, which will make you guys can fight against coccidiosis that attack intestinal cells. Third, prevent overcrowding. It's easy to get stressed when it's too crowded. Stress is bad for our health. Fourth, optimum hygiene. Usage of disinfectants such as phenol can be used to treat the house before getting new batch of chickens. Fifth, pest control. Pests can be mechanical vectors of coccidia. It introduces coccidia into the house. Pest control can prevent outbreak. There is also a vaccine available to prevent coccidiosis. This is to prepare your immune system to fight against the disease if you're actually exposed to it. I'm sure if you follow my treatment plan, you'll be better within 2 weeks.
Thank you so much, doctor. I feel so much better now.
That's great. You look healthy and fat today.